I'm delighted that my next guest is Stephen Dorrell, former Conservative MP and former Conservative Health Secretary. Stephen, good morning to you.
Good morning, Alastair.
The Independent newspaper says UK heading to lockdown by back door, and I think what they really mean, if you read the piece, is England. And certainly the Mirror goes with 9 million on the edge of facing a further lockdown in the UK. Is that the right way to go forward, in your view?
I fear it is. I think that we're in a position where, to be honest, the government has acted too slowly in dealing with what is a developing rate of infection, rate of transmission around the country. And unfortunately, of course, we've been here before in that the government acted too slowly in the spring as well. So I do think that a fire break, whatever phrase you want to use, actually the opportunity is there to do it at the same time as school half term, which would of course have the effect of achieving a fire break without having the same disruptive effect on children's education,
sure,
as would be the case if you did it in a normal term time situation.
What the critics say it is to achieve what? And they say it both of Wales, but also of Manchester and Liverpool. What is supposed to happen during that period of time that means that when it's lifted, we won't be pretty well back where we were, albeit slightly lower down the rate of infection?
Well, you make it sound as though, Alastair, being slightly further down the rate of growth of infection is somehow incidental. Actually, that's, of course, the purpose. It would be lovely if there was a magic wand that could achieve a total solution here, but there isn't one.
No, I take that point completely, and I'm not belittling it at all, because it means lives will be saved and cancer patients can be looked after and all the rest of it. But it doesn't solve the problem of learning to live with this wretched virus. We are not going to terminate and get rid of this virus.
That's true. But I think that the point I was wanting to make, and which I think a lot of the commentary is missing at the moment, is that we're still heading into winter. We know that there is a growing rate of infection of COVID and, of course, of other health conditions as we go into the middle of winter. That's the big difference between the position we're in now and the position we were in the spring. And to achieve a break, a reduced rate of spread of this infection as we go into the middle of winter is an important gain from the point of view of life-saving, but also of the maintenance of the full range of health services through the midwinter peak that we know always puts huge stresses on the NHS and other care services.
Be talking later on in the programme about this report that's come out showing the incredible stress and strain that's being experienced by NHS workers. You, as I said in my introduction, you're a former health secretary. You know these people very, very well indeed. It almost paints a picture, given what you were just saying about heading into the winter and flu and all the rest of it that comes along when it's cold, wet and windy, with nurses and doctors and specialists under stress. I mean, the NHS is on the brink, Stephen.
I wouldn't describe it actually as being on the brink, but it's certainly under strain. And we know, don't we, that there were a huge range of health conditions which normally arose in the normal course of events earlier in the year that have now added to waiting lists. Waiting lists are at an unprecedented high because non-COVID conditions haven't been treated during the early part of this year. And it's precisely that issue, alongside the rising rate of infection as a result of COVID, that I think makes it important for us to be taking whatever steps are necessary. And that's why I think a fire break is a relevant step. Whatever steps are available to us to ensure that there is that we reduce, so far as possible, the increased activity, the increased demand being placed on the health service. And this point can't be overemphasized. At its normal peak period, December, January is always a peak period for all the reasons we know.
You talk about the Welsh fire break there. In your view, is what's happening over the last few days an example of devolution, whether it be Scotland, Wales, Northern Ireland, or whether it be partial devolution to the great cities like Manchester and Liverpool. Is it all an indication that devolution is working well, or that at a time of national crisis you should have a firebreak on devolution?
I don't think we should be having a firebreak on devolution. No, I don't. I do think that the direct answer to your question is that it's evidence that it's working. It's not working as smoothly as perhaps we would like, but it is working. And it's one of the things, isn't it, that if we look around the world, which societies have been successful in responding to the COVID crisis. Well, the example certainly in Western Europe that's been most successful, I believe, is Germany, which has had a much stronger tradition of local decision making. And I think that it's one of the things that we are learning too slowly, but learning nonetheless, about how to respond to the crisis during 2020.
Do you think Rishi Sunak, the Chancellor, should therefore find the money that Burnham wants to protect those jobs in Tier 3 that at the moment only look like getting 67% of wages, and whack it up to the furlough 80%? It's a lot of money.
It's a lot of money, but I absolutely think that the Treasury needs to be recognising that there isn't actually a choice. It's a completely false choice between health and wealth, or health and the economy. We need to sustain the economy, and go back to the point, to be ratcheting the support down at a time when we're going into the period of maximum winter pressure seems to me to be unfortunate timing, to put it no stronger.
But there's another piece in the Independent on page 8, which I read and I then reread because it kind of shocked me very slightly. Quotes, "The Treasury is unsure how the tier system will hit business." Treasury boffins, some of the brightest men and women in the civil service, they just don't know what's going to happen to the economy. And there's you, a former senior minister, saying, well, chuck some more money at Manchester because it's the right thing to do. I mean, at some point, someone's got to grab the handbrake, haven't they?
Of course, that's right. But I'm sorry, I'm repeating myself, but I think it's a key point. That to be ratcheting down the support at a time when we know that the maximum pressure is about to be applied for all the reasons that happen every year. Winter happens every year. This is not the right moment to be ratcheting that support down. It's the point at which ratcheting it down is going to do greatest damage.
I want to ask you something about the science, as it were, because you served under Margaret Thatcher, who famously was she was a lawyer, but she was also initially a scientist, and therefore
indeed
a chemist. Yeah, so would have had some kind of grasp, at worst, of the language that was being used by SAGE and the various scientific advisors, but might well have even gone further. How do you judge, Stephen Dorrell, the relationship between the current government, led by a classicist, and those scientific advisors? Should they give them more benefit of the doubt? Should they be more critical and questioning? Just give me your take on how that crucial relationship is developing.
Well, I don't think it's developing in a positive direction, let's put it that way. At the beginning of the pandemic, there was a huge amount of emphasis placed by ministers on the importance of following the science. And I was saying then in interviews that I did with you and others, Alastair, that the important principle needed to be to, first of all, to recognize that science doesn't speak with one voice, but to ensure that the advice that ministers receive from science is taken in public, and people can see the range of scientific opinion that's being offered, and the means by which a scientific consensus is arrived at. I don't think we've got to that point. I think it's important, particularly when there are high levels of uncertainty and a developing understanding of the science. I think it's important. Scientific knowledge it needs to be distilled. It needs to be given in public to ministers. And then when, as has happened over this question of a firebreak, ministers choose not to take the scientific advice, there's a huge burden of proof on ministers to explain why they know better than the scientific consensus. I think that the ministers were right to place emphasis on science at the beginning. But what we haven't done is to learn the subtlety of science and the complexity of science and learn how to deal with changing advice during the pandemic.
Final point, again, during your lengthy ministerial career, there were various divisions within the Conservative Party. There always have been, whether it's on economic policy and or
not
whether
only the Conservative Party, to be fair.
Absolutely, no. But you've only ever served the Conservative Party, so, so I can't.
Until recently, I recently joined the Liberal Democrats.
I was going to mention that, and I stand corrected by that in more recent times. Indeed, so. But and it gives you authority to say this perhaps with even greater clarity. What would your message be to the likes of Sir Graham Brady, chair of the 1922 committee, and many, many others, not least in Manchester, rocking the boat? Is it time for the Tories to shut up and pull together, or is it quite right and proper that people of Graham's calibre say what they really think?
Oh, I feel very strongly about this, actually. Members of Parliament don't, in all parties, are not elected simply to follow the dictates of the party whips. And it's one of the things the government has consistently got wrong during its period in office, in my view, is its disrespect for Parliament and its unwillingness to engage in a public dialogue and to secure consent. It's one of the key issues, actually, in the management of this pandemic. You can't manage these kind of situations without public consent, without public discussion. And Parliament has a key role to play in that. I actually think Graham Brady, when he insisted a few weeks ago that these measures need parliamentary support and parliamentary consent, he's asserting a principle that, in truth, the home of one of the oldest parliamentary democracies in the world, it's extraordinary. We need instruction on that, but we do, because it's a key part of maintaining consent in a democracy.
Stephen Dorrell, always a pleasure to talk to you. Thank you very much indeed for joining us at this early hour. Stephen Dorrell there, former Tory Health Secretary, now Liberal Democrat, talking to me from his home. Graham Stringer is in position. Graham's the Labour MP for Blakely and Broughton, but also has considerable experience in local government before that as well. Graham, very good morning to you.
Good morning.
What do you think is going to happen at midday in Manchester?
I really don't know. I've just listened to Andy Burnham. It appears that the government haven't talked to him. They've just sent a letter with an ultimatum. Whether there will be a last-minute agreement, I really don't know.
Let me butt in, because one thing that struck me out, I mean, I went to bed with one set of thoughts and woke up when I looked at the papers with another, and the Treasury are certainly sending out mixed signals, are they not? Because last night it was sort of, no way we're going to hold the line, and this morning there are hints that maybe the Treasury would help out.
I think that's right.
Yeah.
I mean, I think there's been a lot of mixed messaging on this. It's a negotiation that's taking place partly in public, partly in private, which is not ideal. The government have failed to turn up to meetings with any ability to negotiate, and sometimes the ministers haven't even known the details. Certainly one meeting I was in, the minister was not on top of the detail.
Sure. You're a Labour MP and served in local government distinction under Labour colours, but let me put this to you about Burnham as well, because a number of people have made the point. There is an intellectual inconsistency in Andy saying we do not need Tier 3, but if you give us the money, we'll accept it.
I think I can't argue with that. I think this is a point when we need to move away from what could be perpetual lockdowns. They haven't worked in the past. Otherwise, we wouldn't be in the situation we're in now. We need to work towards a position where vulnerable people are protected, but also public health is moved to a local level. One of the strange things, the government is saying that they will give more resources for local public health control if people move into Tier 3. Well, in actual fact, they should be giving that to Tier 1 and Tier 2 to make sure the infection doesn't get worse. The history of public health in this country has been local, not national. The big change this government has made has been to set up a national system of public health, which has been cumbersome and inefficient and hasn't worked. So we need local control so that if a factory needs closing down because there's a big infection or a school or a street, then people can do it very quickly. If pubs or restaurants aren't abiding by the social distancing rules, then local people need the power to go in and close them down very, very quickly.
Finally, and it's a wonderful alliteration because this is a battle of the big beasts, is it Burnham versus Boris?
Well, I don't think it should be characterised like that. This is too important. The government have failed to get this virus under control. It's a definition of insanity to carry on doing the same thing when you know the results aren't going to work. We need to change the strategy. The government needs to be bold enough to admit they've got it wrong and move to local schemes which will be much more effective.
Graham Stringer, good of you to join us this morning. Always good to talk to you. Thank you very much indeed. That's Graham Stringer there, Labour MP for Blakely and Broughton, up in Greater Manchester. So on Friday, Wales begins its fire break. I was talking to the Times correspondent a few moments ago who pointed out that there was grave concern in certain rural areas where they say they don't have a problem. Why are they being shut down? Whereas in the urban centres, yes, there is a problem. Mark Drakeford, the First Minister, said, no, we're going to do it right across the spectrum, whether you be down in beautiful Pembrokeshire or whether you be in Cardiff. My next guest is Gerald Jones, who's the Labour MP for Merthyr Tydfil and Rumney, and is also the shadow Secretary of State for Wales in the Westminster Parliament. Gerald, first of all, how does that work when you've got devolved Wales and you've got Mark Drakeford as a First Minister? You're still shadow Secretary of State for Wales in Westminster. I mean, literally, ignorant question on my part. How does it actually work out?
Well, I should point out, first of all, it's Shadow Wales Office Minister. My colleague Nia Griffith is the Shadow Secretary of State, and I support Nia in that team. And both of us work very closely with the Welsh Government and are the voice of the Shadow Wales team.
Sure, gotcha.
In
that's my ignorance, and I apologise profusely for that to you and indeed, more importantly, to Nia, I suppose, as it were. But so did Drakeford tell you what he was going to do, or did he have to ask your permission to do it, or do they just do their own thing?
Well, of course, health in Wales is a devolved matter, so it is a decision for the Welsh Government. But we work very closely with the Welsh Government and have a regular dialogue with not just Mark Drakeford, but with other ministers too.
I'm going to be really Machiavellian now and say that reminding folk again that you are part of the shadow Welsh team led by Nia in Westminster of a party that is led by Sir Keir Starmer, who wants a national lockdown. That's his policy. Machiavelli would tell me that, in fact, what Drakeford is up to in Wales suits your national UK purpose very well indeed.
Well, I think Mark Drakeford and the Welsh Government have been very clear throughout the pandemic, and I'm very cautious, in fact, in having that approach, and have put because at the end of the day, the virus is different in different parts of Wales, different parts of the UK, but it's for the Welsh Government to make decisions on how things operate in Wales, and obviously that there is a link across the UK, but it's very much led by the issues that are happening in Wales at this time, and trying to keep the communities of Wales safe.
But within Wales, and Will from the Times was making the point earlier, and it's been on television and radio, that tourism is vitally important to Wales, and in those beautiful rural areas that are so popular with people in the rest of the UK and indeed around the world, there is not a COVID-19 problem. It is in the urban centres like Cardiff and the industrial south where there's a real problem. There is no medical or scientific logic to having a national lockdown in Wales. So say the business interests in Wales.
Well, I think the point is that there are increasing cases in all parts of Wales. Obviously, in Cardiff and the South Wales valleys and the more urban areas, the cases are growing faster. But I think there are growing cases across the country, and I think the Welsh Government have taken the very practical and pragmatic step to sort of look at Wales as a whole, because that way I think the the advice is clearer to people. And, after all, it is a short, sharp fire break, and it is an opportunity to under control because, we're seeing hospital admissions going up across the country. And, we want to make sure that, obviously, as we go into the depth of winter, that our hospitals and NHS are not overwhelmed, and ultimately we don't have more deaths from COVID.
What do you think would be the acid test then? Because I heard Mr. Drakeford on radio last night saying, of course, we do this for 14 days, but we won't know for another 14 days whether it's been successful or not, and whether we need to consider doing another. What do you think the yardstick of success would be? Because you need to know that if you and Sakir are arguing for it to be done right across the UK. How do you test success? What's success look like?
Well, I think, what we saw in the first part of the pandemic, the restrictions that were put in place at the end of March, that didn't have huge results initially. I mean, it does take a few weeks for that to feed through. So I think, with this short 2 weeks, I mean, we're not expecting the figures to come down immediately, but over a period of time to give that period of respite, really, as we go into to the depths of winter. There is obviously the hope that the infection rate will decrease. It may not be in the first 2 weeks, but certainly shortly thereafter.
Nervous times.
Well, I think absolutely for all parts of the UK, and nobody has a silver bullet in this situation. It is trying to do the best we can to make sure that the NHS isn't overwhelmed and to give us an opportunity to have that respite. But it does take, I think, everybody to play their part. This is something that everybody needs to do to help to keep themselves, their families, and their communities safe, ultimately.
Gerald Jones, good of you to join us. Thank you very much indeed. That's Gerald Jones, who is the Shadow Welsh Minister, not Shadow Secretary of State. That's Neil Griffiths. That's my mistake, not his. And how terribly modest of him to correct me in that matter, saying that there is no silver bullet, but this is the best option that confronts the Welsh devolved government at the moment. Susan Michie is Professor of Health Psychology and Director of the Centre of Behaviour Change at University College London. And my notes say is a member of SAGE and Independent SAGE. Are you on both of them, Susan?
I am. There are several of us on
That's
both
very clever. I didn't know that, and that's the second thing I've been corrected on this morning, and I don't mind because
they're very complimentary.
Well, I can understand that. I'm going to spring this on you because it's literally just been sprung on me. Expert partnership to explore and establish human challenge studies of COVID-19 in the UK, testing vaccines, and this is Imperial College with the private sector, testing vaccines on human beings. Jonathan Van Tam says, and I quote, "A safe, fully approved and meticulously controlled human challenge model for COVID-19 that is conducted by experienced experts may help in the search for safe and effective vaccines." As I say, I'm springing it on you. How significant does that feel, Susan?
Well, this isn't my area, but I do know something about research ethics committees. And in this country, we do have very stringent ethics committees. So I assume that it has been examined in great detail as to the ethical and safety aspects of this. Beyond that, I can't comment.
Okay, I fully accept that, and as I say, I've just literally been given it. We're hoping to find some other folk that we can test it out on. Director of the Centre of Behaviour Change, this definitely is one for you then. What do you suppose is supposed to happen in Wales when they have their shutdown in terms of the behaviour of the Welsh folk that will stop this virus then spreading yet again with equal rapidity in just 2 weeks' time?
Well, what we've seen over the last few weeks is that the different regional measures and the changing measures have caused considerable confusion amongst the public, and that's been associated with a failure to prevent the transmission rates rising. And we're seeing the transmission rates rising all over the country and all over Wales. Obviously, it's greater in the cities than in the country, but it's still rising in the country, and it's only a matter of time before the low rates would end up high.
So you're in favour of across the piece shutdown?
From that point of view, I think that for people to adhere maximally to the restrictions, and that's absolutely essential to get the R level below 1 so that we can contain this pandemic again. It means people need to understand what they're meant to do and also the rationale for why they're meant to be doing what they're being asked to do, which in many cases is extremely challenging. And if it's done on a national level, it does mean that everybody's being asked to do the same thing at the same time. And I think it's been very clearly explained in Wales. So I hope from that point of view, with good leadership, good explanation and understanding of what the alternative is if they don't do this, I hope that people will adhere to it and they will be able to turn the corner. But obviously,
what leadership,
no country's an island.
No, I understand that completely. But what leadership is going to convince me if I run a boating holidays business in North Norfolk on the Broads, or if I run a lovely glamping holiday centre in distant Cornwall, where the rates are very, very low of this wretched virus and showing little or no sign of increasing.
Absolutely.
Why should I shut down?
Yep. I think there are two reasons. One is the rate is going up relentlessly, even in these areas of Britain that you've mentioned. And it's only a question of time before they will be in tier 2 and then in tier 3. And the second reason is that the only way we can defeat this pandemic is at a national level. We're never going to be able to defeat it by small pockets because there are no borders. We're not sealing borders between areas of Britain. There's no intention to do that. It just wouldn't work. And so therefore we have to take a national perspective to getting out of this pandemic. But I completely understand it's really tough. But this is why leadership and explanation is really important to ensure that everybody pulls together, as they did at the beginning of the pandemic, understanding why the alternative is so much worse. It's rather like a fire. Imagine there's a fire in Britain. In some places, it's roaring out of control. In others, there's just little tiny smouldering bits of fire. Either way, you can't put your back on it. You can't turn your back on it because otherwise the whole country will be up in flames.
What a brilliant, albeit contentious analogy, but a brilliant analogy to end on. Susan Michie, Professor of Health Psychology and the Director of the Centre for Behaviour Change at University College London. Thank you very, very much indeed. And as Susan said, she's a member of SAGE and unofficial SAGE, which is the other group set up to kind of challenge the first one. But she said she's not alone in that. There are quite a few who do that.